Good morning and welcome to the April edition of Policymakers Live. I am excited to welcome Senator Julian. Welcome, Senator.
Good morning. Good to be with you.
Before we get started with today's program, I just want to thank today's event sponsor, Takeda. Thank you for all you do, Takeda, to make sure that MassBio is doing everything possible to continue to drive our mission forward of making Massachusetts the best place in the world for the life sciences. Senator Sear, we are delighted to have you here today. This is your third term in the state Senate. You are Assistant Majority Whip. Congratulations on that. And you also are a member of 9 committee assignments this session. That seems really something else. Chair of the Joint Committee on Mental Health, Vice Chair on Joint Committee on the newly formed Committee of Racial Equity, Civil Rights and Inclusion. You're also on Healthcare Financing, the new COVID-19 Committee, as well as a number of others. I know you have a lot going on this session, and I'd be curious to hear, how's the beginning of the session going? What kind of priorities do you have as you were going into this new session?
Sure. Well, first, thank you, Zach, for having me, and it's good to be with all of you. Albeit virtually. I know there's certainly fatigue about doing these things, via a screen. But for someone who lives in the outermost reaches of Cape Cod, right? I live in the outer Cape. Y'all saved me probably a 4-hour round trip. In my car, and that's without traffic. So good to be with all of you. Just like a little bit about me. So I was elected to the Senate in 2016. Prior to all of that, I'm a lifelong Cape Codder. My family owned a seasonal restaurant, which I grew up in. I spent more years of my life waiting on tables, working behind the line of a restaurant than sort of anything else I've done. But very much also of a public health wonk, especially a health policy wonk. And so prior to joining the Senate, I worked actually both the Patrick and the Baker administrations in the Department of Public Health. And really since being elected to the Senate, have really focused on, health equity. How do we sort of really get right public health? And I think there's a lot of things and health more broadly. And I think there's a lot of things we do really, really well in Massachusetts. And there's a lot that are sort of like profoundly, deeply, unnecessarily like complicated. And so, as we're getting into this session, and certainly the biggest thing we've been doing, of course, is COVID-19, which is in a lot of ways really sort of sucked all the air out of the room. And whether it has been reopening, the second surge, and now really into this vaccination, which has been a very frustrating process, that has consumed so much of our time. But we really sort of try to walk and chew gum at the same time. And so really kind of staying laser focused on policy. A lot of that work has been through the lens of behavioral health. The Senate president really has a vision of transformation of mental health care in Massachusetts. Simply put, mental health is just too difficult to access. There's too many barriers. And it was a real crisis sort of before the pandemic. The pandemic, as in so many things, right? The pandemic took and has taken currently, these gaps and cracks and vulnerabilities that we had and have in our society and really cleaved them open to be gaping fissures. And one of that is in the space of mental health. So the Senate took up and passed a major piece of mental health legislation last session. We didn't get a standalone bill through the House, but we did get about a third of those provisions in the Mental Health ABC Act signed into law. And so we're going to be coming back at it, really kind of continuing this work. I've really said that transformation of mental health is more than sort of one bill, more than one session. So that is first and foremost on our priority. I'm very kind of eager to continue the work around health equity and really meeting the moment of racial justice work, which I think has languished for too long. We've got a lot of work to do right here in Massachusetts. I'm also focusing on offshore wind and also a lot of work around equity for the LGBTQ community. I'm one of 2 out members in the Senate. And really making sure that there's a lot of low-hanging fruit that we sort of haven't done in Massachusetts. We've been sort of resting on our laurels, right? We've been folks who said, oh, we did marriage, we're good. Well, that was almost, not quite 20 years ago, but almost. I was in high school then. And there's a lot of other important work we need to do, particularly around supporting transgender people, queer people of color. So those are just some of my priorities, but we do not rest on our laurels in my office. And so we're working on a myriad of issues.
Excellent. Yeah, no small feat. And no big deal, right? To handle all that stuff this session.
Well, I mean, you're in a position, you're in these positions where, if you're not working your butt off, it's such an honor to be able to serve and to be able to serve at such a consequential time. If you're not taking advantage of it, what are you doing in this work?
Well, I know your constituents very much appreciate that. So let's talk a little bit about your district. I mean, I know you've been outspoken on COVID response, especially around vaccines. The life sciences industry, especially here in Massachusetts, is incredibly proud of what our member companies have been able to do around the development of diagnostics early on, therapeutics on an ongoing basis, and vaccines, obviously, which are getting the most attention, rightfully so. That work has only become a thing over the last 12, 13 months. It's gone from 0 to 100, quite literally, and the results have been amazing. What's the sort of feeling in your district right now as it relates to vaccination? Do your constituents feel like it's going well? Do you feel like it's going well?
So I've noticed an interesting thing. My constituents did not feel vaccination was going well, and they're really, and we've talked about this publicly, the governor made, in my opinion, some real missteps in abandoning longstanding planning around emergency preparedness, around vaccine distribution. And that was really frustrating, especially for the residents of the Cape and Islands district. These are the oldest communities, not only in Massachusetts, but in New England. Barnstable County is the oldest county in New England. And so, the sort of lottery Ticketmaster style registration website didn't work for my constituents. We sort of pulled together as a region and have figured this out, and now have the highest vaccination rate in the state, really, as we should, right? Because we're so darn old. So what I have found is that constituents were very frustrated. I mean, I have never received more correspondence, literally to the point that we can't keep up, right? When you get 650 voicemails in your Google Voice box, right? You're using to take calls from your office because you're all working remotely. I mean, there's no way you can get back to everyone, right? I have a team of 5. It's not going to happen. Yeah. But what I've noticed is the minute folks get that shot in their arm, it's like they have a physiological release of endorphins and their anxiety and their anger. I mean, I had one constituent who literally had sent me an email being like, the way the state is doing this is elder abuse. And then I followed up and this person said, oh, well, I have my shot. Things are great. So for those of us who are wanting to hold the administration accountable, it's a little frustrating, right? It's wait a minute, this was really screwed up. So I think broadly there really, I think, is a real feeling of gratitude, particularly around what life sciences has done. And I think it's a real vindication of, the investments that this state, that the Commonwealth, under Governor Patrick, and really been continued around life sciences. And that's really paid off, not just for us, but it's paid off for the country. It's paid off for the world. And if anything, I've been sort of talking about this as a model of saying, hey, this life sciences investment, look at what this did. We need to be talking about these sort of, these similar kind of investments when it comes to offshore wind, right? Which we should be the leader in offshore wind. And those jobs should be benefiting islanders and Cape Codders who are hosting these sites, in our distant waters. We should be having a similar level of investment when it comes to hospitality and tourism, which is the 3rd largest sector, in this state. And yet, we don't really think we spend $10 million in tourism promotion. Right? That's inadequate. So I think what life sciences has really shown for me, right, is when you make these sort of investments, that this level of government investment can unlock such potential, not only from a workforce perspective, but really in allowing people to have rewarding, fulfilling livelihoods. So I think that's what I think. There's a lot of gratitude. Certainly, I think just like we're not resting on our laurels, I think you folks, aren't resting on our laurels and on your laurels, and whether it's around, what we did for COVID, what y'all did for COVID, it's remarkable. How do we make that happen for HIV? Right? It's not lost on me as a queer man, right? That the kind of effort that was mustered for COVID-19 didn't happen for the AIDS epidemic for 10, 15 years because of who it was affecting. And really then I think thinking about, all right, the next hurdle that's coming is vaccine hesitancy, which is a real thing and a real challenge. And I think we're gonna need y'all to be sort of allies and partners in that next stage of this work.
Yeah, I really appreciate that. And I think, we're trying to do our part. We've launched a campaign called It's Our Shot, where we're specifically talking to Black and brown communities across the state and using the messengers of life sciences employees who are Black and brown. These people had a role in the creation of the vaccine in a variety of ways. Even if it wasn't the vaccine, we have plenty of Black and brown people working in our industry that should be speaking out and sharing their stories. And we want to be able to be a vehicle for that, why they're getting their vaccine as soon as possible. So we want to be additive in that approach as well. But going back to something you said, about government supporting industries and being a partner, I couldn't agree with you more on that front. I think, you look back to 2008 and the launch of the Life Sciences Initiative initially under Governor Patrick, that really was the way as a springboard for taking Massachusetts for one of the best places around for the life sciences industry to really undisputed best place in the country and probably the world at this point. And that didn't happen by chance or by accident. So the application to other industries, whether it's offshore wind or otherwise, makes a lot of sense. We wouldn't be here without that government support now and into the future. Yeah. So, thinking about that a little further, I think the gratitude for the life sciences seems to be at an all-time high. I mean, you look at public polling, there's a positive view of the biopharma industry for the first time in a long time. I think legislators, policymakers, they're humans too. They're living this life too. I'm curious your perspective about, how our industry may be able to work, educate, et cetera, with legislators at the State House to build on this momentum and have positive dialogues around issues like drug pricing and whatnot.
Yeah, I think it's a good question. I think a good example, right, of where we've been able to work well is especially, is around the step therapy bill for first legislation, right? And really, look, physicians or healthcare providers should be working with, patients, particularly patients dealing with rare diseases that are complicated challenges. That level of work, that should be between sort of the patient and the provider. And the requirements of sort of the insurance companies or the, I should say, payers, right? This is actually not just public insurance, it's private, it's public insurance and private insurance, right? But basically this is a real short-sighted practice that's about sort of potentially sort of short-term savings, right? But long-term actually results in likely higher costs, less, just a whole list of complications that are not kind of right and fair and okay for patients. And look, price has got to be part of this conversation, right? Because we're on a rather unsustainable path in all of our healthcare, right? You look at how, you look at just where we're going and how much we're spending on healthcare, and that's not great, right? And I think you guys got to be part of that conversation, but so too do the payers, so too do the providers. And I think broadly, we've also got to move away from this emphasis on, in the actual provision of care. There's a real emphasis on, sort of the sexiest specialty care, right? Which is important work and helps save people's lives. But I'd really argue, and I kind of tend to agree with the governor here on this, that we're sort of spending too much in the specialty realm, and we need to sort of drag might be the accurate term here. We gotta redistribute some of this stuff, really looking at primary care, at behavioral health, at geriatric care. How do we really figure that out and do that? And the challenge within all this context, right, is that our healthcare system is profoundly complex and complicated, right? This isn't a look, I'm a real sort of proponent of, I think the way that we sort of do things here in the United States from a healthcare delivery perspective is pretty darn flawed. And I'm a strong supporter of some either Medicare for all or some sort of single payer structure or system. One, because the government's paying half of healthcare costs anyway. But two, we see some real inequities, and I think COVID-19 has really exposed that. But how do we get there? It's a real challenge, right? Anyone who tells you oh, we're just going to sort of switch to this new system, just doesn't understand how it works. I use this analogy of a rubber band ball, right? That's what our healthcare policy system is like in Massachusetts. And we've been layering. And as tempting as it is to just cut the damn thing in half, the whole thing would fall apart, right? And so we've got to figure out that path forward. And so I think being I think with engaging with legislators, being honest about, with us about, what has really worked, where are areas that kind of don't work and need to be improved. But that like, we're really in this sort of reform transformation shift, at least I am kind of for the long haul. I'm very honest about the fact that these are really we've got a really remarkably complicated rubber band ball here that we're dealing with, to use a poor Staples analogy. And so kind of figuring that out, that's how I'd really suggest y'all continue to work and engage with us. And look, if you look at where healthcare reform is going, it is going towards more accountability. I think we should be honest about that. And I think everyone's going to be part of that accountability. But what the specifics are and what that looks like, that's what we all can, try to work to figure out.
Yeah, I appreciate that. And I think, MassBio and our membership is eager to have those discussions. I've been having a lot of meetings with your colleagues over the last few weeks to talk about some of the ideas we have around drug pricing or around patient access and affordability. These are critical issues to patients, and we need to get it right. And there's a lot of ideas out there, certainly some of which we don't agree with. But we need to be having the discussion, and we need to make sure that the understanding about how this really, really complicated system works, especially around drug pricing, because drug pricing tends to be somewhat opaque. And I think the other issue that we run into a lot is that, the price of a drug gets conflated with what patients pay based on their plan design. So in a lot of cases, that doesn't actually have much of a direct correlation. So there's confusion about, should we lower prices? Is that going to impact patients, and how so? So we really want to have those conversations and think about what the solutions are to make sure when a patient goes to the pharmacy counter, they can afford their drug, and what the levers are that can help with that.
Yeah, absolutely. And I think a patient, looking at how patients, and really all of us, right? Because all of us rely on drugs, at least at some point in our lifespan. And particularly that cost piece. The challenge I think you folks have, right, is that everyone knows these stories of, people who've just been sort of saddled with that, that big pharmaceutical bill, or, concerned that if their health insurance went away, that they'd be stuck with this sort of $30,000 bill, right? And that's not right. And look, let's be honest. I think some of this stuff, is on you folks a little bit, but also some of it's on insurers, some of it's, and all of it's on this like pretty complicated screwed up system we've all built, right? And so we've got to figure out, how do we sort of undo this, and how do you have a healthcare delivery system that really is making sure that we're getting care to people and we're intervening early. I really come at this from a public health approach, right? And so, this is where, you get someone having a routine visit with a primary care provider every year. What that's going to do to drug prices, what's that's going to do to insurance costs, what's that going to do to, a myriad of other kind of drivers of cost in our system. I really think that's really, that bang is worth your buck, just like in mental health, right? There was so much resistance for so long around doing telehealth. Well, the pandemic forced our hand, and it's been transformational. If you look at no-shows, which is a really good indicator, no-show rates are very high with behavioral health care. Just because you got to show up for an appointment. It's like weekly or twice a week or every other week, right? And people's lives are busy and complicated, especially if you're grappling with anxiety, depression, with other mental illness, with a substance use disorder, right? Telehealth has like transformed this. I mean, the no-show rates have plummeted, and it's really people are getting access to care in a way that is really making a difference. And is there going to be some short-term higher costs there? Yeah, but I bet that you're going to see a lot of savings, and by the way, more importantly, better life outcomes, which is allegedly what we're all in the business here to do. And so I think it's that kind of thinking. In Massachusetts, our problem is we're either going to be the first in the nation to do something, or if we're not first, I don't know if it's because we're a small state or our fragile ego, New England egos, or whatever we've got, or we're going to be the last, right? And so telemedicine is an example of, I go to these conferences with colleagues, pre-pandemic, of course, and you talk to some states that like have downright backwater health policies in a lot of areas, who probably don't have rights for someone like me, right? But they've got telehealth and it's working great, and it's serving rural constituents, like underserved urban areas. And so I think it's just an example of I think telehealth is just a really good example of like how policymaking works in Massachusetts and doesn't work in Massachusetts. And if you're trying to figure out how to navigate in that environment, study telehealth. I think it's an apt example.
Very interesting. I want to remind our viewers today that you can submit questions into the comments on YouTube directly, and we'll try to get to as many as we can before the senator has to go. Senator, the idea of cost avoidance, and prioritizing primary care really resonates with our industry, and it certainly around the drug usage and uptake makes a big difference in cost avoidance. So I do appreciate your comments a lot in that realm. I think it can make a real difference in patient health. So your work on the step therapy bill, I can't reiterate enough how important that is in making sure that patients get the drugs they need to make them healthy, keep them out of the hospital, and that kind of thing. So thank you again for that. I would be remiss if I didn't thank you for that.
Well, we got to get it signed into law.
We are all here, our members.
The Senate passed it unanimously. We did it last July. We need to get the House to take it up. We've got great partnership on this. But I think really eager to this is something that we should get done. I think it's that important. And I think the Senate supported that. We moved very quickly on a piece of legislation. I think this is the first time, we had filed it, at least in this form. So eager to do so again. I think it was very promising that we could get such swift action on it in the Senate. And this was sort of at the height of the pandemic, right? So there was a very short list of non-COVID related issues that we took up, particularly to the tail end of last session. And if it wasn't COVID, if it wasn't racial justice, there's maybe on one hand other policy issues we took up.
That's awesome. And we are here to help and want to support. We know our patient communities, this is one of their top priorities. So let's talk about your district a little bit. How are you thinking about the summer? Obviously, tourism is a huge issue on the Cape, and we're getting close to that time of year. How are things looking?
So if you saw the Boston Globe this morning, front page above the fold is an article that we are expecting a very busy season. And yet we really need workforce. Workforce is always a challenge here. If you look at what's happened on Cape Cod, really, over the course of my lifetime, right? In the 90s, especially in the 2000s, the value of this place has only increased. We have a housing market that's really geared towards second, third homeowners, and there's value there, but really we've sort of left behind housing production for working Cape Codders. And so this is something that's been happening for decades. We have increasingly relied on a seasonal workforce, H-2B visas and J-1 visas. I know this industry can sympathize with the prior inept federal administration that attacked those programs. Even though I will note that the Trump organizations actually relied on the H-2B visa program for their stupid golf courses or whatever. But in the pandemic, the irony just continues to stink. Even though I'm glad we're far from that. But so these visa programs, were a bit of a solution. But in the pandemic, where folks can't travel, or the biggest problem is the embassies actually haven't opened. So you may have your visa, whether through a J-1 or an H-2B, but if the embassy isn't open, you actually can't get that visa. And so our employers here on the Cape and on the islands are faced with a real prospect that we've never had higher bookings. And yet no one, we've never had more help. So if anyone watching has a family member, a kid, you maybe want to take a reprieve from your exciting biosciences job and come and scoop ice cream or wait tables, I will note that I look at the skills that I use on a daily basis, right? What are the skills I use every day? It ain't the fancy education. It's the restaurant skills. It's like waiting on tables for 14 seasons. You can put up with someone in August. You can deal with an irate constituent. Right. But in all seriousness, this is a big challenge for us. We currently are I think actually Cape Cod's a very interesting example of sort of where I think this pandemic is going to go for the next period of time, which is one, we have the highest vaccination rate in the state. And when it comes to older adults, we're just not seeing older adults getting sick, which means we're not seeing people in the hospital, which means we're not seeing as many deaths because we've done a relatively good job of reaching these older adults, albeit in a very inefficient, disappointing, frustrating way, but we've gotten there. On the other end, we're seeing a very significant outbreak, basically across the population center, right? From the mid-Cape to the upper Cape and the lower Cape. The only part of the region that has not been affected with this current outbreak is the outer Cape where I live, which is pretty darn small, right? We got like towns of 2,000 people, 3,000 people, and then Martha's Vineyard. But the rest of the region has seen a real spike in cases with what may end up being a third wave. And a lot of that is driven by, folks letting their guard down, and indoor interaction. And then also, particularly from a workforce perspective. So if you look at our workforce here, got a lot of people who, got multi-generational families who are living in a 3-bedroom house with a lot of people. We know that that's very efficient for COVID spread. We also know that the variants are present here, and we're testing for it, and we're looking for it, and we're finding it. And so you have these sort of twin, our vaccination rate is sort of like creeping up, and we're like racing to get more vaccines and more shots in arms. And you're also seeing a real outbreak among, people kind of, Zach, our age, right? And younger, you're seeing it in high schools. And so the solution for us is we got to vaccinate as many people as possible. If current vaccination levels keep up, and if we get a little bit more, which I think we're going to get, we should be able to vaccinate most all of our population before high season. The other piece, last year we had a lot of trepidation about what last summer was going to be. We expected a pretty muted season, and we were worried that visitors were really going to contribute to community spread of COVID-19. And that didn't happen. We were wrong. And we actually were able to have a relatively busier season than expected. And we had very low levels of COVID-19, very little evidence of community spread. So I'm cautiously optimistic again that hopefully we can get over this third surge quickly. We can vaccinate more of our population. The visitors who come here, almost 80% of people who visit Cape Cod are from New England or from New York, New Jersey, those Northeast states. So they're very much, they've always paralleled us in the pandemic. So if we can keep up the vaccinations, we can get over this third wave, we keep these reservations, we're going to have all these people visiting us. I think we're going to be able to do it safely. I just think people are going to need to, one, continue to be following these good masking practices, masking, washing hands, all that good stuff that everyone knows. One, we got to do that because our younger population is not going to be vaccinated. So there's going to still be a risk. And then two, people are just going to need to be a little patient because it might take a little longer for you to get your ice cream cone or your fried fish sandwich or whatever. So just urging patience. Please come enjoy. The good news is that what you do here on Cape Cod is often not in the summer. It's not conducive to COVID spread, right? You're not getting COVID at the beach. I mean, like if you make out with someone, maybe you'll get COVID. But like you're not going to get COVID on the beach. You're probably not going to get COVID on a boat. You're not going to get COVID going on a hike in the national park. Right. I guess unless you get really close. So that's I think the good news. But the current outbreak and workforce is going to be a challenge for us.
Yeah, it's very interesting. And, I think I agree, we're reaching somewhat of an inflection point here. It seems like supply is going to outstrip demand, not too far into the future.
I can't wait.
It's going to be a beautiful thing. We certainly had, as an industry, some consternation a few weeks ago when the governor called out some of the vaccine manufacturers for not meeting supply promises. But in fact, we look at the data at the end of last week and they've met all of their obligations, promises for getting supply. And it just seems like the numbers coming to Massachusetts keep increasingly on pace. So we're very happy.
I don't think the manufacturers should deserve much blame here. I mean, we can call the governor for a lot of things that did not go well in this vaccine rollout. That's not, I'm sure there's been supply issues. And there's that major issue, of course, that was happening in Baltimore, which the Biden administration has really stepped in. But we, on the ground, we definitely feel a change. And our challenge now is just figuring out how do you coordinate all this, right? Because you've got a fragmented healthcare delivery system. We abandoned the sort of plans that, the governor abandoned the plans that basically were had for local health to sort of lead this work. We can sort of debate whether or not that was the right idea or not, or decision or not. And so now it's sort of up to, here on Cape Cod, it's up to our county, it's up to our hospital system and our community health centers, and trying to coordinate, just the coordination, all of that, right? We don't have a mass vac site here. We basically had to create our own large scale vaccination. And so figuring out kind of how we do that, and also making sure that we're reaching the most vulnerable folks, right? I was talking to my friend, Rebecca, who's a Jamaican woman who works in a local market, right? And this is interesting around the vaccine hesitancy, because when you actually look at, nationwide, the polling on this, you actually don't see a big difference, a significant difference in, willingness to sort of hesitancy or willingness to take the vaccine among white folks and folks of color. But what you do see, right, and talking to Rebecca, I was saying, hey, Rebecca, you're gonna get your shot. And she said, well, I want to, but I'm gonna wait a little bit. And then she was telling me how in Jamaica, tuberculosis vaccination, TB vaccination is mandatory. And it's something that I guess you get it basically gives you a sort of mark for the rest of your life. And how she was saying that a lot of folks sort of have had sort of bad experiences around TB and sort of questions like, is this going to be TB? Is this sort of one shot and done? Do I have to kind of come back and do it? And it was just a really interesting, and really is now what, not just interesting, but informs the work that we've got to do now, right? Like if we're not figuring out how we get a vaccine to the dishwasher at the lobster pot and the person who's mowing the lawn at Chatham Bars Inn, right? And these are the people who literally make our economy hum and run. If we're not figuring that out, one, we're letting them down, right? Because they have been the folks who disproportionately been most impacted, even by the epidemic here on Cape Cod. But two, we're not going to do a good job in containing cases. And so that's why, regionally, we're really kind of focusing on, all right, how do we figure this out? But it's remarkably complicated. I'm still sort of wondering, I'm like, how am I involved with this? It's not the state senator's job to be like, all right, we're going to set up a clinic here. We're going to do this and we're going to do that. But, it's all hands on deck, at least until this summer. And then looking forward to enjoying the fruits of my district, which is a lovely thing for someone like me, especially when you used to, work 6 days a week waiting on tables in August.
Sounds awesome. I can't wait for summer. We have our first question from Tim Miley. From
Sure.
Gilead.
Oh my God, Tim Miley,
Tim,
a former colleague of mine from the Department of Public Health. I'm still stunned. I love that Tim has this job at Gilead. I think he's anyway, Gilead's a big company in my community, of course, because we very much rely on HIV-related medications and especially PrEP. Hey, Tim.
Tim has given you a question, which is right in your wheelhouse here. What lessons from COVID do you believe can be used to improve our response to existing epidemics like HIV, especially addressing equity and investment in our public health system?
So first of all, that urgency, right? What COVID showed is when life sciences with government investment and research and support really gets in on an issue, wow, all of y'all move fast in an incredibly impressive way. Almost so fast that on the government healthcare distribution end of things, the challenge was really in sort of meeting how fast it went. And so I think that sense of urgency, particularly is crucial. And yes, COVID has affected so many of us, but when we talk about, people talk about, oh, COVID-19, the worst pandemic in a century. When you actually look at the numbers, right, this is actually the second pandemic of our era. And if you look at global deaths and even national deaths from HIV, there are some comparable numbers here, right? And I think we don't see that because we focus on who it's affected, right? And for a long time, people didn't care that gay men and IV drug users and people of color, we're living with AIDS, we're dying with AIDS, right? And so I think that lesson is really important, right? And bringing that equity piece is there. I think two, investment in public health. This is non-negotiable. This needs to be as important and as well funded as what we do in this nation around defense. And as someone, I've got a bit of bias here, but as a former as a health policy wonk and a former mid-level bureaucrat at the Department of Public Health, I have seen how these programs and these agencies have been, were eroded in the Great Recession, were not restored. Specifically, the Department of Public Health went through an early retirement incentive program that was an early Baker-Pluto administration priority. I think of the people that Tim and I worked with the Department of Public Health who aren't there. I wish those people, who have decades of experience were sort of at the helm of this vaccine rollout. And so we just need to view public health investment, yes, health in all policies, but not forgetting that core public health work that's informed by, with a health equity and a racial justice lens. And that needs to be as well funded, really, we probably shouldn't be creating more sort of sacred cows, right, in our budgeting, but if y'all didn't support public health, after this, and also how we fund public health, right? So if you look at how the agency is funded, the Department of Public Health has more line items than any other agency in state government. There's 64 or 68. That is absurd. And what it means is that the agency can't kind of pivot and respond when there's issues because their hands are tied. Similarly, we have 351 local health departments in a state of like just under 7 million people. That is insane. So we've got a lot of work to sort of rebuild and to reinvest and make sure that we have this response capacity. Like this needs to be viewed as important as national security as defense.
Yeah, it's interesting. Historically, policymakers, state and federally, have not been good at looking ahead and planning ahead for things like public health emergencies or pandemics. And we've seen this firsthand. From our perspective, it's exciting that Massachusetts' companies in our industry have been able to pivot so quickly around drugs, but also looking at things like medical device. We now have companies in Massachusetts that are making masks, making ventilators, making some of that PPE and medical supplies necessary to treat patients now and into the future. And the next pandemic that rolls around, we're going to have better capabilities and better availabilities right here from our state. I think that applies to across the country too, when you think about the pharmaceutical supply chain and how we can do a little better on making sure we have redundancy and capabilities there too. So I know you have a Senate caucus coming up this morning. I wanted to just give you the platform here at the end of our discussion. If there's anything you want to discuss with our group here, this is mostly government affairs type folks at our member companies. And I know you have great relationships across our industry, which we very much do appreciate. But any final words for our audience today?
Sure. I would say, well, Tim, I'm very eager to get this PrEP bill over the finish line. We've had legislation that basically would allow those under 18 to get access to PrEP without parental permission if they qualify. This is really important, particularly for queer communities. And if you look at HIV infection, where we're seeing the rise in HIV infection, yes, is among IV drug use, but then also second is among queer youth and especially queer youth of color. So we're going to get that bill done. And I think more broadly, let's be honest, we're going to have a debate about, drug prices and what sort of that transparent, what are the guardrails? What's the transparency? What's sort of the, how does this apply to cost trends? All that sort of stuff, right? We're going to have that debate in the conversation and we're going to figure something out. I think we need this industry, which has been such a success in the Commonwealth, to also push us on other important issues. I think of housing and the housing crisis that we have, not only here in Eastern Massachusetts, but across Massachusetts. We've done a very poor job really in anticipating, what our housing needs are. And we really rely on this parochial system that too often ends up sort of thwarting housing production. And that really ends up having racist and classist ends. And so, whether it's here on the Cape or in Greater Boston, if we don't figure this out, right, like I actually can't afford property at the part of the district that I live on the Outer Cape because it's so, I wouldn't be living here if my family didn't sort of have a foothold here. And really we here on Cape Cod and on the islands, I mean, we're sort of the canaries in the coal mine here about what happens when you don't have, adequate housing for people. And I just think that the life sciences industry, y'all have been so successful. That investment, that was made under Governor Patrick and continued has been so beneficial. And yeah, in part, it's probably actually contributed a bit to some of the rising housing costs we've seen, particularly, in that Cambridge area, Cambridge-Somerville, right, corridor. It would be awesome to have all of y'all as sort of a partner in pushing the state to do more here. We passed the governor's sort of housing choice legislation. It's good stuff, but it's low-hanging fruit. And really, we've got to really figure out a way to move beyond this hyper parochial system, which frankly is about preserving, those who've got some, who've got theirs, and preventing those who don't from having access to the community, from living there. And I think especially for those of us on listening who are white folks, we have to really acknowledge how state and federal housing policies have benefited us as white people for generations to the detriment of Black and brown folks and Indigenous folks. And so that's just one piece where drug y'all are gonna spend a lot of time on drug pricing, and we're gonna do a lot of sort of work there. But let's not lose sight of some of these other really essential sort of quality of life, pieces that are really going to determine, the viability of our economy here, yes, in Eastern Massachusetts, but across the Commonwealth. What we do on housing, that is where I really see us sort of choking off choking off opportunity is through housing. And then of course we've got to we've got to like have an all hands on deck response to the climate crisis. And we did some good work there with recent legislation, and we've got to keep that up. So Zach, that's sort of my suggestion, is saying, hey, like what can we do on housing? Because this is just so darn urgent. And it's so complicated because of the very parochial nature that we govern ourselves with land use planning in Massachusetts. And I think the legislature deserves to be pushed a little bit, from an industry as significant as life sciences to get this right and to do more.
Yeah, and we want to be part of that conversation. That's a competitive issue for us. Massachusetts is the best right now, but it's no guarantee it's going to stay that way. And housing and transportation are number one and number 1A in no particular order, that affects about whether college grads and postgrads want to stay in Massachusetts to work and whether people want to come here to work in our industry. They take one look at the housing market and they say, there's no way I'm moving to Massachusetts. I can't afford a house. Doesn't make any sense.
And they're probably making good money in your industry, right? You're not talking about a low-paying industry. So if your industry is struggling with that, like imagine what this means for our restaurant industry, for hospitality, and it results, tying all back full circle to public health and COVID. Look at where COVID decimated most, right? It is our most dense, it's our most dense workforce communities, who are largely immigrants and people of color, right? Chelsea and Everett. And if that isn't sort of an indictment on Massachusetts and what we've not been doing right, it is not okay that we haven't addressed housing production. And by the way, it created a huge vulnerability for our state and created a heck of a lot of suffering, tragedy, and death because of our inability to address it. So anyway, I'm bringing it full circle.
Well, we just got one more question. If you have just
Sure.
one more minute, and then
time.
we'll get you out of here. Katrina Iserman from Synovian, she asked, beyond telehealth, what more do you think we can do to address the tsunami of behavioral health needs that are resulting from the pandemic?
Oh my God, a heck of a lot. So first, we got to pass capital P parity, right? That we've had parity laws in the books at the state and federal level, but payers we're still not seeing parity. That's got to be fixed. My colleague and friend Senator Friedman has a bill on this. We passed it in the Senate. We're going to do it again. 2, we need to look at workforce. So we actually haven't invested in our behavioral health workforce, and we need to do so. And there's actually a number of initiatives that we passed in the FY21 budget that were originally part of the Mental Health ABC Act that get at this. How do you create a pipeline of talent, specifically around providers, behavioral health providers, who look like their clients, look like their patients? We estimate about 90% of the behavioral health workforce are white people, right? That's not going to be effective. That's 90% of the population of Massachusetts is not white. I know this personally, right? In my outpatient mental health care, right? My therapist is a gay man. That's really helpful for me, right? And it's part of my successful treatment. Well, if we don't have a pipeline, particularly of Black and queer and Indigenous, and folks of color, right, who are our providers, right? We're not going to meet the moment. So we've got a study actually that requires EOHHS to sort of give us an inventory and then have a roadmap to how we fix it. So a lot more kind of around workforce. There's a lot of screwed up licensure stuff, and what board can do what, and you need mid-level. You need certain mid-levels in various fields. So there's a lot of kind of licensure work that has to be fixed. So workforce parity and then access. And we see real barriers. Anyone and I'm sure you've heard these stories. Anyone who's had to encounter you need acute mental health inpatient treatment. You're going to the emergency department and you're going to be waiting there for not hours. You're going to be waiting there for days. Mm-hmm. We have an ED boarding crisis on our hands, and it's very complicated, and we've got to figure that out. So really parity, workforce access. If you've got ideas or solutions or anything, I'm all ears. I have an awesome Liz Gans in my office is my general counsel and legislative director. We're working to take what we did in the Mental Health ABC Act and keep at this. I said it at the beginning, right? This is a multi-effort, multi-session, multiple bill effort. The Senate president has a very clear vision here. We've got great partners in the House and in the administration on this. And so those are just some of the pieces that we're going to work on and just keep pushing that envelope, right? And also keep talking about it. I think it's really important that people talk about mental health. I think that's a real barrier to care is the stigma that people have. And so, the Senate president really exemplifies this, talking about her family's experience. I really try to do my best, right? Talking about someone who, in my life has grappled with anxiety and depression, how therapies helped me, and treatments helped me do things I never dreamed I could do, including the gig I have now. So like that's also really important. And I think folks on this, who are listening today, really can also do that in their own lives.
Great, Senator. Well, thank you so much for your time today. This has been an awesome discussion. I really look forward to working with you this session. I know our members feel the same way on this range of topics we discussed today and more. Hopefully we'll be able to see each other in the building sometime soon. And I want to thank our sponsor again, Takeda, today for supporting today's event. Our next Policymakers Live for May is May 11th at 11 with Representative Jay Livingstone, who is the Vice Chair of the Healthcare Financing Committee. Look forward to talking with him. He also represents a big portion of Cambridge. So it's going to be a great conversation. I hope you'll join us then. And you also join us at our annual meeting, our State of Possible event on May 19th. Look forward to seeing you all soon and have a great day.